Welcome to the Deep Dive. Today, we're diving into parasitic infections in dogs, specifically two that seem to confuse everyone: canine toxoplasmosis versus neosporosis.
Yeah, classic vet school dilemma, keeping those two straight.
You sent us a really in-depth research review, dense, even for me. But that's what we do here. Break it down for brilliant minds like you.
Exactly. We'll untangle the differences between Toxoplasma gondii and Neospora caninum, why those differences matter, from diagnosis to treatment.
When I think back to vet school, those parasite life cycles, nightmares. But understanding how these two differ is a good place to start, right?
Definitely fundamental. The article jumps right into those differences. For N. caninum, dogs are the definitive hosts. They shed oocysts, contaminating the environment, infecting others, even us.
Okay, so a public health concern already. But with T. gondii, dogs are intermediate hosts, right?
Yeah.
They don't shed those oocysts.
Right. Cats are the definitive host for T. gondii. Dogs can get infected, but don't spread it through oocysts. Totally different transmission.
Huge for control, especially in kennels or breeders. Speaking of, the article really highlighted vertical transmission, especially with N. caninum.
Yeah, and a major route of infection for puppies. Transplacental transmission can cause, well, a lot of problems. Abortions, stillbirths, even neurological problems in newborns. We'll get to the clinical stuff later, but considering N. caninum in breeding dogs, especially those with a history of reproductive issues, is so important.
Absolutely. Another thing, I had to go back and look at the figures, the tissue cyst structures. Figure 1, if you have it. N. caninum cysts have this thicker wall.
Isn't it interesting? They went deep into immunology, explaining how the thicker wall might help reactivation. It could be protection from the dog's immune system.
A little parasite fortress. T. gondii hides out unless the immune system crashes, but N. caninum is like comeback time with just a few hormone changes.
Exactly. And this difference in reactivation impacts how we manage these infections, especially in, say, pregnant dogs or those with other health problems.
Different life cycles, transmission, even the parasite structure itself. This all affects how common these infections are in dogs globally, no?
Definitely. The paper looks at seroprevalence rates worldwide. It's fascinating how much they vary. T. gondii in dogs, for example, ranges from 1.9% in kennel dogs in Japan to a whopping 98% in stray dogs in Egypt.
98%. Almost every stray. Shows how environment, practices, even culture can influence the spread.
Absolutely. And it highlights the need for location-specific control strategies.
Makes you appreciate the complexity of veterinary epidemiology, huh?
Yeah.
What about risk factors? It's not just location, right?
No, not at all. With T. gondii, the usual things pop up. Dogs that roam, scavenge, hunt, they're at higher risk. Exciting for them, but it increases their chance of eating infected prey, a primary route for T. gondii.
So a dog that chases squirrels means a chat with the owner about T. gondii prevention.
Exactly. Client education is key. For N. caninum, age isn't as big a factor as with T. gondii. Breed seems more important. German Shepherds, Labradors, and Golden Retrievers, the research says.
Interesting. Why is that?
It might not be that they're more susceptible. Probably related to breeding in certain lines. If N. caninum is already in the line, puppies are more likely to be born infected.
Vertical transmission. Shows how important pre-breeding screening is.
Absolutely. Knowledge is power, and here it's the power to stop transmission and protect future generations of dogs.
Okay, so we talked transmission, risk factors, even saw those microscopic villains up close. But now what we all want to know, what these infections actually look like in our patients.
That's the thing. Both T. gondii and N. caninum are sneaky.
As if parasites weren't already.
Right. They can be subclinical. The dog's infected but shows nothing.
Silently carrying these parasites. We wouldn't even know.
Exactly. Diagnostics are key. But we'll get there. When those parasites do show themselves, clinically, they can be dramatic, especially neurologically.
Neurological presentations. Always tough.
You're telling me. But this is where those little differences matter. T. gondii can cause a bunch of neurological issues, from seizures to behavior changes, but N. caninum seems to love those peripheral nerves.
So that explains the ascending paralysis, especially in young dogs. I remember a case from residency. A little beagle puppy.
A classic presentation. The article highlights those signs: weakness, muscle atrophy, starting in the back legs, sometimes all four. They even explain how N. caninum targets the nerve roots, causing those neurological problems.
Okay, so that's N. caninum. What about T. gondii? Neurologically, I mean.
Well, with T. gondii, it's less about specific peripheral nerve issues, more a range of neurological symptoms. Seizures, ataxia, even behavior changes.
Behavior changes, like forgetting what sit means.
That or more subtle changes in how they act. The research mentioned a collie with sudden noise sensitivity because of T. gondii infection. Makes you think about the impact on behavior.
Wow. That's something else. So we're playing detective. Dog in front of us, neurological signs. How do we know which one it is?
Diagnostics. Luckily, this article goes deep, listing everything we can use.
Let's hear it.
It usually starts with serology.
The good old IFAT. We order that one a lot.
Right. Quick reminder for everyone, IFAT is the indirect fluorescent antibody test, and it's great for finding T. gondii and N. caninum antibodies.
Those antibodies are like warning signs. Hey, this dog's met this parasite before.
Exactly. But a positive IFAT doesn't mean the parasite's the problem right now. Remember, subclinical infections.
Right. They could have just encountered the parasite before, and their immune system's like, not today.
That's it. So those antibody titers, that's where interpretation gets tricky.
Art, science, and intuition.
You got it. A low titer might not be a big deal, especially without symptoms. And there's cross-reactivity with other parasites, Cercocystis, that complicates things.
So how do we make sense of it?
History, neurological exam, and thinking about those titers carefully. We might need to repeat the IFAT after a few weeks, looking for rising titers, meaning a recent infection.
Okay, so rising titers. But what about when we need definitive answers? PCR, to the rescue.
PCR is like zooming in, finding the parasite's DNA, even if it's hiding.
Like those crime shows swabbing for DNA.
Exactly. And for neurological problems, cerebrospinal fluid, CSF, is usually best for PCR.
A spinal tap. Not fun, but sometimes necessary.
Definitely. PCR is sensitive, but the article mentions we can get false negatives, especially if there's not much of the parasite or if we're looking in the wrong place.
So they can still outsmart us.
They try. Good to have a backup. The article talks about other tools, cytology, histopathology, even looking for N. caninum oocysts in poop.
Wait, oocysts in poop? Didn't we say dogs don't usually shed those with T. gondii?
You're right, it's an N. caninum thing. And even then, oocyst shedding comes and goes and often doesn't match up with the dog being sick. Plus, under the microscope, those oocysts can look a lot like other coccidia.
Tricky. So not the most reliable.
It's more useful for big picture stuff, like figuring out how common N. caninum is in a group of dogs, not so much for individual cases.
Got it. So we've got serology, PCR, even looking for those oocysts, anything else in our toolbox.
Don't forget good old clinical pathology.
Right. Blood work, urinalysis, basic, but important.
Definitely. We might see things like liver enzymes being high, CSF changes, even anemia sometimes. Not specific to these parasites, but these findings can tell us how bad the infection is and help us decide on treatment.
Connecting the dots. Speaking of, we tackled diagnosis. What about treatment? How do we fight these parasites?
Good news. We've got some effective options. Like any treatment, it depends on the specific parasite, how sick the dog is, and their overall health.
So, time to unleash those parasite-fighting skills.
Yeah.
What's our best weapon?
Well, we've got choices. But let's start with the classic, clindamycin.
Clindamycin. Seems like it can do anything.
Versatile for sure.
Right.
For Toxoplasma gondii and Neospora caninum, it's got a great track record. The article actually recommends 12.5 to 25 milligrams per kilogram twice a day, orally. We always adjust for the patient, of course, but good to have a starting point.
For sure. As much as we love clindamycin, it's not perfect. Those clindamycin diarrhea calls from owners.
Ah, side effects. We definitely need to warn owners about those. Watch for them. Sometimes they're so bad we need other options.
What's our plan B if clindamycin's out?
Trimethoprim sulfabiazine is good, especially for N. caninum. Might need a longer course, though, maybe 4 weeks or more, depending on the infection.
Patience is key with N. caninum. Anything else we could try?
The research mentioned combining trimethoprim sulfabiazine with pyrimethamine for N. caninum for those really tough cases. Good to have options.
Absolutely. Speaking of options, how about preventing these infections in the first place?
Wouldn't that be great? No magic solution yet, but we can do things to reduce the risk.
Like listening.
Let's start with those dogs that eat anything and everything.
Oh yeah, the opportunistic grazers. Mine included.
It's cute, but risky, especially for T. gondii. Those tissue cysts are everywhere, just waiting.
So, cooked food only. No more late-night snacking expeditions. Got it. What about cats? Should we worry about T. gondii spreading from cats to dogs?
Minimizing contact between them is smart, especially keeping dogs out of litter boxes. And of course, hygiene is key. Hand washing, cleaning those litter boxes every day, ideally with gloves, and keeping food and water bowls clean too.
Got it. Be extra careful. What about vaccines? Anything promising on the horizon?
Wish I had better news. No vaccines for T. gondii or N. caninum in dogs yet.
There goes my dream of no more parasitic brain infections. A vet can dream.
Of course. Seriously, even without a vaccine, we can make a big difference. Proactive prevention, careful monitoring, and the diagnosis and treatment tools we talked about.
Knowledge is power. And the more we know about these parasites, the better we can keep our patients healthy and parasite-free.
Exactly. It's about making good decisions for ourselves and our clients to give those pets the best possible care.
Well said. That wraps up this deep dive. Remember, everyone, you have the knowledge, the tools, and the passion to handle even the toughest cases of toxoplasmosis and neosporosis.
You've got this. Make those tails wag.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.